My name is Victor, physician by training, second-time entrepreneur, founder and president of Sami. Sami has a very simple mission, which is deliver the best medical care available at the lowest cost possible. How can we do that? We're talking about high-quality medicine at the lowest cost. We're doing that in Brazil, offering health insurance to SMBs with a preventive care focus, with a mandatory gatekeeper. Most of you guys here in the Bay Area, you probably know Kaiser Permanente. We're doing a digital enhanced Kaiser Permanente to Brazil, a country where it's one of the top 3 largest private healthcare markets worldwide, but still 75% of people don't have private healthcare insurance, and we are offering 20 to 40% cheaper health insurance to these people with a better quality of care. This is our growth over time. And this is our generative AI case. Together with Google, Ryan is still here. No, it's not. So I told him that we're going to show a Vertex AI case. He was talking a lot about the Google model. And this is the mission we created. We're going to work with Google to organize the world's information, to bring high quality, affordable care to everyone. This is what we did in practical. We delivered an AI copilot for care teams chat, which means imagine one of our members would talk to the nurse, and every one of our members, they have their own nurse, their own primary care physician. And imagine you lost a prescription and you said, oh, I lost my prescription the doctor gave me. I need a new one. So the member would send a message to the nurse and say, can you help me with that? So the AI copilot would offer suggestions to care navigators in next steps of the care journey of each of these members. This is the project timeline that we created at Google. So we started in July, and we created 4 use cases initially. Exam solicitations, renew prescriptions, resend of files, and visit scheduling. So that would decrease the admin costs of their nurses having to manage all this workflow with patients. So we developed the model, and now we are deploying in real world with our nurses from September on. This is the technical framework, Google, Vertex AI that you see there, that Ryan showed in the morning, the API service we created with CI&T, and the chat between our care teams and the members we have. So this is the video. Let's see if it's going to play. Yes. So.
Chegou aqui a mensagem.
No need for the audio. If you can turn the audio off. So the member just sent a message. I need to renew my exam order. So the AI model will offer an answer in real time to the member. Looking for different systems. Let's say the order was expired. Should they go direct to the physician again to get a new order? Or the system can generate a new order automatically. So the nurses just reviewed the model. We believe so far that there always has to be a human in the loop. So someone would review the suggestion from the AI model, and the nurse just press the button and send the message to the patient. I'm going to tell, and this is another. And they can also look at the data behind the AI model. So do I trust what the AI model said? Can I look at the data and check if they're not hallucinating? So the nurse can check that. They can edit the answer before sending to the patient. And this is, for example, a similar case with an exam solicitation that was expired. So the AI model will look in different systems and check. Oh, you really had a order or a prescription had sent you before, but expired. You have to talk to your physician again. So the AI model would again suggest, and this is a print, for example. So here you have the suggestion of the AI. I found in the system that we had a blood test order, for example, in that day by Dr. Alexandre. This order has more than 60 days, so expired, and you have to get a new one. So the nurse just reviewed that. And interesting because here, there's not only the time that the nurse doesn't have to type every answer, but also she doesn't have to go in different systems to look for the information. Because does this patient really get a prescription before? From which doctor? The prescription was correct. So it also not only saves the nurse time in writing the message, but also look in different system, which also increases accuracy of the message, decreasing medical errors, which is a big thing in healthcare. So this is, for example, the user perceptions. The test made clear for navigators that the tool can contribute to the work, mainly to concentrate information in the care team solution, bringing together data from various sources to useful insights for the care journey. And some testimonials from our care team. It's much easier than having to open different screens to find and match information. I think it's going to improve our work because it's much easier than typing and searching for information. After I clicked learn more, I felt reassured on the data backing it. So this is expected results as we're deploying: 50% reduction in average handling time, 50% increase in the rate of members per care navigator, and 80% accuracy with the tool. That is our goals for this project. Just to give a few examples in other things we did in average handling time. The last time we had an OKR to decrease 50% average handling time, we decreased by 75% in a different project that we did. So we really believe this is going to help us deliver a mission to increase quality of care and decrease cost. When a nurse takes less time to take care of a person, they can take care of more people. On average today, every one of our nurses take care of 2,000 people. Imagine with AI, they could take care of 4,000 people, 5,000 people. And by that, we decrease the cost of care, we can sell cheaper health insurance, and more people can afford private health insurance in Brazil because of AI being delivered by the nurses. And this is other benefits for the care teams. AI would standardize operation to scale. For the navigators, higher productivity and higher accuracy, and more time to proactive care. For the member, faster resolution and higher accuracy of care. For the nurse, lower need for supervision because there are less humans mistakes. And for Sami, lower cost of care, higher margin, or lower price and faster growth for us as a growth stage startup. Thank you.